All right, welcome everybody. It looks like we've got critical mass here and are a couple minutes past the hour, so I'm going to kick us off. My name is Carly Strauss. I'm an associate here at Third Plateau. I want to start out by saying a huge thank you to all of you for joining us today for our organizational crisis response webinar. We've got about 45 minutes together today. So we're going to start off with a presentation from a couple of my colleagues, and we'll certainly try to leave some time for Q&A at the end. If you've got any questions while we're talking, feel free to throw them in the Q&A function. You should have an option for that at the bottom of your Zoom window. You can also chat me directly if you're having any technical challenges. And thank you all so much again for being here. And Jonathan, take it away.
Fantastic. Thank you, Carly. And as Carly mentioned, we will do our best to get to Q&A. What I can promise is if you put questions in there that we don't have time to get to, Marie, Carly, and I will cruise through those afterwards and send an email response out to everybody. So anyway, thank you all very much for joining us. My name is Jonathan Kaufman. Given the state of our world now and kids being home from school, I'm doing this from my bedroom because I can actually lock the doors and not have the kids run in for the next 45 minutes. I'm one of the founders and principals here at Third Plateau. We are really excited to get into this, but I want my other co-presenter to introduce herself really quickly before we dive in. Marie, you want to give a little intro?
Yeah, so I'm Marie Huber, and I'm a senior researcher at Third Plateau. I've been there a little over a year. But prior to working for Third Plateau, I was working in international development and humanitarian response. So I worked several years in Afghanistan for local and international NGOs. A lot of experience, as you might expect, with complex emergencies, political instability, violent conflict. Afghanistan is also very highly natural disaster prone. I also worked as the Global Program Planning, Monitoring, and Evaluation Advisor for Concern Worldwide, which is an Irish NGO. They work in 25 different countries. And to give an idea, last year they responded to 66 emergencies. So for that, I was working with our disaster risk reduction advisor and doing a lot of support to country teams on preparedness planning and measuring the effectiveness of their emergency response. And then I also worked in Iraq with Norwegian Refugee Council. We were working in South Central Iraq. It was in the recovery phase post-ISIS, but as we'll talk about a bit in the webinar today, also sort of circling back with aftershocks from that, ISIS attacks, flooding in camps, mass waves of displacement. So working on teams responding to those crises. And that's kind of how we came into this, as I realized last week, a lot of that experience has a lot of lessons and tools that are really applicable to the current moment.
So Marie and I were talking through all of this last week as we're processing this for ourselves, for our organization, for all the clients we work with, and realized between Marie's background and we had spent a lot of time at Third Plateau working on Hurricane Harvey recovery down in Houston. And realized between our the various expertise that we had and experience that we had, that it's often a conversation that most of the nonprofits domestically are not used to having. Maybe there's some small scale things of how you respond to really discrete short-term events, you know, a hurricane, a fire, tornado. But the idea of being in crisis and having the disaster still unfolding is likely uncharted territory for most domestic nonprofits. And so we wanted to put together the information we had and start to share it out because we think it will really help organizations figure out how to navigate what's happening right now and how to get ready for what might be coming. And so this introductory webinar is the overview of how we think about organizational crisis response. I'll get into at the very end what else we're doing in this space, but the spoiler alert is we're putting together a much more in-depth webinar series on each of the 4 critical pieces we're going to talk about today. So really excited to have you guys here. Again, we've got a lot of content and we will do our best to get through all of it. Please put any questions you've got in the Q&A section and we'll do what we can to get to them. All right, so in terms of what we're covering today, we've got the what and the how of disaster cycle management, which is a whole school of thought of how to think through crises like COVID-19. We don't need to be shooting from the hip. Let's build off of what's already been developed in places like Afghanistan and Iraq that Marie was talking about, as well as what we can be doing here. 2 is navigating the COVID-19 pandemic and how it's impacting your organizations, your programs, your target populations, your community. and really how to think through where are the levers for you to actually do something. And then third is mitigation planning and preparedness and contingency planning for what's likely to come next, right? We're all experiencing this where the situation is still unfolding. I think we're all very aware from public health experts that we're ramping up, not ramping down. And so how do we get ready for shocks that we're likely going to feel in the coming weeks and months? So I want to start with the disaster cycle management framework, which is a cycle of 4 phases that's continuously anticipating, dealing with, and minimizing risks. Typically where you like to start is around mitigation, right? So everything on the left half of this is pre-disaster. Everything on the right half of this is after the event or disaster. Mitigation is all about putting actions and plans to reduce the vulnerability or the impact of an anticipated shock, something you maybe are anticipating having. What can you do to really minimize the impact it's going to have? Preparedness is getting everything in place so that if that disaster were to happen, you're ready to go. Response is really the actions you're taking during or immediately following the shock. And then finally, recovery, right? Actions that help you return to some pre-shock state, or ideally even better. I assume it does not surprise anybody that this is where we are currently, right? We are in the response mode right now because we are still very much feeling the effects of what this is, still processing what's happening with the pandemic, and trying to calculate what's actually happening to our communities, to our organizations, to ourselves and our own mental health. We are very much mid-disaster. Want to talk, given that that's where we are, about what's different during and after large-scale crisis like COVID-19. So there's some science here, right? Our brains are operating differently. We're not able to make decisions the same way we were. We're not able to behave the same way that we were. We are, sorry, I'm seeing a question right now about sharing slides. Yes, we'll absolutely share the slides. We're also recording the webinar, and we'll be able to share it out with everybody afterwards. So our brains are not able to access that strategic thinking element we've been able to do before. Next, second one here is that everybody is feeling the shocks, right? This is a global pandemic. This is not isolated to you, to your organization, to your local community. But this also means that, like, as you're thinking through it, everybody you interact with is also processing the shock. Information is rapidly contextually invalid, meaning a month ago, I see the list of who's on this call. A month ago, you guys were all fantastic at navigating your organizations and the climate that you were in. But that world doesn't exist anymore. And so this thing has just changed really, really quickly. What we thought we knew about the people we were serving maybe doesn't apply anymore. I mean, the dynamic of this is changing, hour to hour, if not day by day, hour to hour. Fourth one here is that cascading impacts make long-term planning. We wrote increasingly difficult. I've spoken to many of you. Impossible is maybe or laughable is maybe a better frame for that. Nobody on this call in this webinar knows what the world's going to look like 60 days from now. I would bet most of us don't know what the world's going to look like 3 weeks from now. So the idea of having conversations of how to get ready for a year or 2 years or 3 years from now is just really, really difficult. And that type of thinking is not all that relevant for this exact moment. Problems that existed in a normal context might not be relevant anymore, right? The solution that you were providing a month ago maybe was fantastic. It might not make sense anymore. The crisis context creates new problems and opportunities to be of service in other ways. And then finally, is what used to be unexpected is now expected, which means we can actually plan for it, right? We can be strategic in how we go about navigating it because we know, okay, this is our reality. This was unpredictable several months ago. 6 months ago, this was unfathomable for most of us. And now it's our day-to-day life. It's impacting everything, which means we can start to get a handle of it and figure out what to do. So that leads to the big question, right? What do we need to be doing right now? So we're going to start with response phase and how we think through navigating a response phase, which is really 3 different steps. Step 1 is the rapid needs assessment. Step 2 is response planning, and step 3 is implementation. I'm going to talk about each one of these. I want to highlight that the rapid needs assessment is happening both internally and externally. right? It's not just that your program itself is changing, but the realities for your organization are changing rapidly, and the realities for the people you're trying to serve or the organizations you're trying to serve is changing rapidly. So within that the rapid needs assessment, I cannot stress enough how critical rapid is here. This has to happen exceptionally quickly. And we're going to talk about ways to think about that in a second here. But I want us to first focus on the external rapid needs assessment. Everybody's time's at a premium. Don't waste it, right? You're not going to get, people aren't going to sign up for multiple times to have a conversation with you. So really pick your opportunities and strike while the iron's hot and make the most of that time together. Your audience is experiencing traumatic stress. You've got to be empathetic. If you try to operate in business as usual, or if you try to ignore the reality of where the situation they're in, you're going to be missing something, right? We want to be approaching this with a do no harm mentality. We want to be sympathetic and empathetic to the reality that people are living through, and really thinking through how we can be of service. 3 is that the marginalized communities in your community and around are likely being impacted more severely. This is not like an equalizer of everybody feels this the same way. It amplifies where a lot of those differences and disparities were. So keeping diversity, equity, and inclusion front of mind is absolutely critical. Maria, I want to talk about the internal and then open up the floor if there's anything else you want to add on the rapid needs assessment. For the internal, things to be thinking about, staff safety and well-being. How is your staff doing? How are they processing all of this? What's going on in their minds? Are they actually safe to be doing what they're doing? Do they feel safe about it? Logistics and operations. What's happening with your program right now? How is that actually, what's being impacted and how is that functioning? Staff capacity. Are you allocating resources in the right places? Are critical essential programs being sufficiently staffed? Are staff members sitting around with a whole lot of free capacity right now? How are you allocating those pieces, or how is it being impacted? Finances. Spoken to a lot of you about what's happening with donors right now. What is the reality with your finances, and trying to take a real assessment of what's the reality that you're experiencing. Leadership. Do you have strong leadership in place? Is your leadership team and your board of directors, are they engaged? Are they accessible? Are they part of helping think through what the solution is? Are they absent and distracted with other things? Communication. What are you hearing? How are you communicating out? How are you sharing messages? How is that being impacted by the current reality of COVID-19? Information systems. All of the infrastructure that goes into helping support how you operate, what's being impacted and how? Marie, anything you want to add on the rapid needs assessment before we go to sort of move through this?
Yeah, maybe just to emphasize that you should actually be doing some kind of assessment where you are talking to people outside of yourself and the key internal stakeholders at your organization. It's very tempting to just rush into the latter phases of this process without doing that step, especially because every part of this step will be more difficult. It'll be harder to reach people. It will be harder to get their time. So really thinking about this in terms of what is the minimum amount of information I need to collect to update my understanding of what's happening. And that also when you're thinking about target populations, it's critical that you do this according to different segments of the population you serve, who will be experiencing this very differently or similarly. Yeah, I think a good analogy for this is thinking about first aid and first response. There's a whole series of steps that you go through to assess all of the different damage before you start responding. And it's really critical that you start with this needs assessment first.
Yeah, so the metaphor that Marie and I have used on the first aid side, right, is if you see somebody who's injured and you go and you see they've got a wound on their hand and you start to repair it, great, their hand might be okay, but you haven't assessed whether or not they're breathing. And so really trying to take a full assessment of where something is before you start to figure out where you want to operate. The other thing to really keep in mind on this, as Marie's talking about the segments here, it's really easy. And again, we talked about the brain is not functioning in the same strategic way that it was a month ago. It's really easy to hear, hey, I'm experiencing this crisis. What I'm experiencing is likely what everybody else is experiencing. And that's a really dangerous mindset to be in. You want to get yourself talking to individuals from as many different segments that you can to really understand what they're experiencing, what they are feeling, and what they're thinking through something, to have an accurate assessment of what's going on, right? You don't go to the doctor and the doctor says, well, I feel sick, so you must be sick too. It's really trying to be focused on who your stakeholders are and what they're experiencing at the time. Step 2 is response planning. So once we actually know the rapid needs assessment and what's happening, we can get into a real planning phase. Again, it needs to be very scrappy and quick, but there are 6 things we want you to lean into as you're doing this. One is to base your decisions on the rapid needs assessment. I know that sounds obvious, but we can't stress that enough. One of the biggest mistakes that gets made in crisis management is just acting before you get information, or then acting on things other than that information. Get informed and base your decisions off of that information. You're not going to get perfect information in the rapid needs assessment. You're going to get good enough information. Take it, move forward with it, and continually try to get better and better information as it goes. So that also gets to the second point of thinking like an entrepreneur. You are not going to design the perfect response plan sitting at your table, writing it out on a computer, and sending it to your staff. You need to get a good enough response plan out the door so you can start to work with it and see what's working and see what's not, and make it better from there. Again, being fast is a real advantage here and is going to allow you to help at a much deeper level. So get out there and act quickly with the information you've got. 3 and 4 are very tied to this, in that if you're acting quickly on good enough information, you need to constantly build ways to get more information and get better informed about what's working and what's not. Build feedback loops to hear how things are processing and how they're being rolled out. Be transparent about the decisions you're making, so that all of those wonderful, brilliant, and passionate people around you can flag maybe where there's blind spots or where there's other opportunities. 5 is to always keep your organization's North Star in mind. The vision that you are driving for with your organization, the ultimate impact you are built to deliver, has got to be your guiding force here. Don't lose sight of it. The programs and how you've delivered that in the past may or may not still be relevant, but the problem that you're trying to solve and the people you're trying to solve it for is. Be clear about it, stay focused on it, and always make it the center of your conversations and your decisions. Finally is leaning into your organizational values. And this might seem like a funny one to include on something as serious as a response phase for crisis, but it's absolutely critical. The values in your organization give you the framework by which to make decisions. The trade-offs that you are having to make right now and that you're going to have to make in the coming weeks and months, you want to make those trade-offs based on your organizational values. It's the common language that all of you have. And so leaning into it and playing to it and explaining the decisions you're making through those values will help get your team on the same page and moving in the same direction. Maria, anything you want to add to response planning before we go to implementation?
Maybe just to re-emphasize what you've already emphasized, that this is response planning, not responding. It's critical that you plan before you respond. Otherwise, you might be doing something that is adding just more chaos to an environment that's already quite complex and chaotic. And that I kind of think about this as essentially a variation of strategic planning based on your rapid needs assessment. And a lot of the steps overall will look pretty similar. It's just the pace and how you're going about them should be quite different.
Yes. Yeah, so a lot of you know us from strategic planning work, which can take, anywhere from 4 to 12 months to do well. This is how quickly can you possibly get it up and out the door, which I think is that the entrepreneur mindset. But to Marie's point, and what we're saying, and cannot say this enough, plan before you act. You can actually do damage by acting quickly without having it be informed or without planning about what it's going to look like and how to do it. So that gets to step 3, which is actually just go implement your plan. Don't worry about building a whole lot of buy-in to something. Get out there and start doing it. Build buy-in along the way. That's a huge difference between, how we typically think about strategic planning in, quote unquote normal times, and how we deal with organizational crisis response. You gotta act quickly, get out there, put things out there, get feedback on it, and make it better as you go.
Just one thing that I'll add. to that,
Please.
Jonathan, is just clarifying coordination. If there are other actors operating in your space, then it's not necessarily the same as achieving buy-in, but part of your response plan should address coordination to avoid duplication or gaps in coverage.
Absolutely. All right. So this disaster, I'm sorry to be the doomsday person here. Normally that's Marie in our conversation, to give her a hard time for it. But this disaster is still unfolding, right? Every day this is getting more real, more intense. 3 million people filed for unemployment. Like, this is significant, and it's likely going to get worse before it gets better. So how do we plan for what's next? This is where we start talking about mitigation and preparedness phases. I want to, if you can think, I don't have the slide in the right order here to talk about it, but if you think back to the cycle of mitigation, preparedness, response, and recovery, that's for each individual disaster, right? The outbreak of COVID-19 is a disaster, and gets us going through a cycle. But all of the cascading impacts, you can almost think of as an entirely new disaster cycle. And so we actually have an opportunity to get out in front of the things we're anticipating. We talked about things that were previously unimaginable or unexpected are now very, very much expected, right? We know unemployment rate is going to go up. We know people are going to be under a financial crunch. Organizations are going to be under a financial crunch, right? Endowments are being decimated. What happens to foundation giving moving forward? There's still a massive public health crisis, right? How big is this going to get? Who is it going to impact, and how severely is it going to impact them? There is the mental health of our communities. We know that it's taking a toll, and if we stay cooped up for another month or two, it's going to be significant. Schools are closed right now, right? What does that mean in terms of how we start to think through, like, okay, what kind of future crisis might that then lead to? So this is our chance to get out in front of the cascading impacts that I think are reasonable now to assume are coming. There are 5 key steps here to think through mitigation and preparedness planning. One is general risk assessment, and I'm going to walk through exactly how to think through risk assessing. Step 2 is event-specific mitigation planning, identifying what specifically are you anticipating and how do you minimize the potential impact that event could have. 3 is event-specific contingency and preparedness planning. What are you anticipating, and how are you going to respond if it actually comes into place? And the preparedness side is, how are you actually making sure that when, if it does come to be, that you're ready to act on day one, and you're not then trying to get your house in order to get ready for it. Step 4, implementing your mitigation and preparedness plans. And then step 5 is starting to monitor that risk and knowing when it's right to put a contingency plan into action. So we're going to walk through each one of these and sort of talk through what the mitigation and preparedness phases look like. So general risk assessment. 3 steps to this. First, identify all of the potential shocks you're anticipating that are relevant to your work. Step 2, estimate the risk of each potential shock. We have a very simplified way to think through what actually is the risk and to start to quantify it so that you can compare different types of risk. And I'm going to walk through how to do this in a second, but the headline of this is, how likelihood is that shock to happen? What is the potential impact if that shock were to happen? And how vulnerable are you to that shock? If we create a little, low, moderate, and high, 1, 2, 3 ratings, 3 being high, 1 being low, for how likelihood it is, the likelihood, the potential impact, or the vulnerability, and average it out, you can have a pretty, back of the envelope way to start comparing risks and figuring out what you want to prioritize over other things. And that's really the step 3 piece is to prioritize. So we're going to use a soup kitchen example to walk through this. So I put just 4 very quick potential shocks that I'm anticipating. I'm anticipating my donors aren't going to donate at the same level they were, right? I'm anticipating volunteers might not show up. Maybe they're scared, maybe they're sick, maybe our communication broke down and we don't know to let them know that our times have changed. I'm anticipating demand to spike, right? If unemployment keeps going up, if people are losing jobs and people are in financial hardships, my soup kitchen might need a lot more demand to it. I'm also nervous about spreading COVID-19 in my program, right? I'm thinking again here about internal and external risks. My donors don't show, my donors don't donate, my volunteers don't show are internal risks to me. Demand spikes, program spreads, these are some external pieces that I want to be mindful of. I then go through for the donors and say, okay, likelihood that my donors aren't going to donate, pretty high, right? We're already seeing that across the sector. It's terrifying, it's scary. There's interesting, exciting ideas out there, but my traditional donors are not going to donate the same traditional way. The potential impact, it's high. If I don't have the ability to fund my program, I don't have a program. Vulnerability, it's maybe more moderate. I can think of some creative ways where I'm less dependent on that traditional type of giving. So I add those all up, 3, 3, and 2, and divide it out, so I'm averaging. And my risk assessment for donors not donating is a 2.67. I then want to do that for the other risk factors, the other potential shocks that I'm anticipating. Again, your list is likely much longer than this and probably more nuanced than this. But actually go through the exercise of thinking through what are the most likely things that you're anticipating, what's the impact of them, what's the vulnerability, and then averaging those scores out. And what you can see in that far right column is, okay, I need to be focused on how can I mitigate the spread of COVID-19 in my program. I don't want my program to be furthering this public health emergency. And I want to be ready for, okay, if this starts to happen in future ways, how do I get ahead of that? How do I make sure that I'm planning against that? My second biggest priority here is donors aren't donating. Great, what can I put into place to start to move on it? And you can see my last priority on here is my volunteers not showing up, which, like, just taking a step back in a sniff test, it should make sense. But being able to actually calculate the risk for each of these is going to allow you to start to prioritize. Actually, before we go to the event-specific mitigation, Marie, anything you want to add for general risk assessment?
Just to say that this step, general risk assessment, is broad-ranging. You're thinking of everything that might potentially affect your organization or the population you serve. And it should be quite detailed and exhaustive as you're doing this assessment. And you also should be documenting what you think those impacts that it might have would be, so that you're able to keep those front of mind as you're moving into mitigation and preparedness steps. And then to say that moving into the next step, you'll be doing those for specific shocks. So this is where you're listing out all the shocks that you need to plan for, but then you'll be developing mitigation and preparedness plans for each of those shocks. How you respond to donors not donating will be different than how you need to respond to volunteers not showing up. So it's not just creating one preparedness and contingency plan, it then becomes shock specific.
Fantastic. Okay, so let's talk about that shock-specific or event-specific mitigation planning. Again, this is about me trying to minimize what is going to happen or maybe even prevent it. So start with your highest priority risks, right? On the slide before, we identified the program spreading COVID-19 as my highest risk. Start there. What steps can I take now to mitigate or prevent their impacts? Right? I could instruct all employees and volunteers, please don't come if you're sick, right? Stay home. I can screen people that are coming in. So if they show symptoms, I'm not letting them in. I'm finding a different plan for that. I can install sanitizer stations. I can create new food handling protocols. I can, put in some pretty severe social distancing practices into my actual facility. There's lots of things that I can do to prevent or mitigate that high risk from actually happening. Next one here is the contingency and preparedness planning. Okay, let's say that my mitigation effort wasn't as successful as I wanted it to be. Or even still what's been mitigated is still significant. How am I going to respond if an anticipated shock occurs? Right? The outbreak of COVID-19 has already happened. We're in response mode on that one. We're not in contingency, like you're probably playing catch up on contingency planning. But the reality is, like, thinking about what is likely to come and getting out ahead of that is incredibly valuable. What are you anticipating happening and what is your game plan? Financially, if your donors aren't donating and you can't make budget, what is your contingency plan? The preparedness side of this is, what are all of the things you can do now to ensure you're ready to activate the contingency plan? The key message here, and this is where a lot of us are feeling the stress of right now being in this moment, we didn't have a contingency plan for a global pandemic. We were not prepared for a global pandemic, which means when we should be focused on responding, we're actually having to go backwards and go, okay, well, what's our contingency plan here? What do we need in place to get prepared for it? If we can design those plans ahead of time, we know unemployment's going up. We know all of these other things that are happening. If we can get out ahead of it and plan our contingencies now, and then the preparedness side, get into place all of the things you need so that as soon as a crisis does happen, you can activate a contingency plan immediately. So I want to give a couple of examples here, right? Like if I want a contingency plan around the spreading COVID-19 around my facility, okay, well, I can mitigate it, right? I can say, okay, we're gonna screen people, make sure they don't come in if they're sick. We're gonna have social distancing. We're gonna have different food control protocols. All right, well, my contingency plan, if for some reason we still end up with a spread, my contingency plan might be, all right, what does a delivery program look like, right? How do I physically take the food out rather than having people come to me? How do I keep people safe in that environment? Now, preparedness planning is saying, all right, to actually activate that contingency plan, what do I already need? Well, do I have cars? Right? Do I have all of these things laid out right now? Do I have drivers? Do they have licenses and insurance to allow us to do this? Do I have the packaging already ordered or know where I'm going to get it from so I can start to deliver these things? I can't just take a tray out to somebody's house. I need probably some type of closed package to be able to give them. So if you start to figure out where all of that's going to come from after the crisis hits, you're late. And you are of significantly less value to the people you're serving in your organization than you could be if you can do all of that ahead of time. So preparedness planning is thinking through your contingency plan, what needs to be in place, get it done now and get it teed up so that if you need to activate the contingency plan, you can. Step 4, implement your mitigation and preparedness plan. You'll note that we're not saying implement your contingency plan. There's no crisis yet, right? Where mitigation and preparedness is getting ready for it. You want to have your contingency plan, but you're actually implementing the mitigation plan to minimize the impact, and you're activating and implementing your preparedness plan to make sure that if it needs to happen, you're ready to go with your contingency plan. Step 5 is to monitor your risk and set triggers to activate contingency plans. It's not enough just to have a contingency plan. When do you know that it's time to actually use it? My guess is there's probably also scales and degrees that different types of contingency plans kick in, right? If I have one donor who doesn't give, all right, maybe that's a pretty minor contingency plan. If 80% of my donors don't give, that's a very different type of contingency plan. So what are those triggers that let me know I'm ready for a contingency plan? And how am I monitoring and tracking those various risks and indicators to know that, yep, okay, it's time. Now we're ready to get into action. All of this is designed to help make it so that we are, when a disaster strikes, again, we talked about the brain doesn't operate in the same way. So let's remove that as a need in this and get into operations and action mode rather than the strategic thinking mode. Do all your strategic thinking now so that when something happens, if something happens, you can just get into action mode and start running with it. Marie, anything you want to add to these other than the fact that I wrote step 4 twice?
Nope, that was all great.
Fantastic. Okay, recovery phase. I know this is a hard thing to wrap our head around right now because we are very much still in the response phase and trying to get out ahead of future shocks in the mitigation and preparedness phases. Recovery phase should be your top priority right now, along with the mitigation and preparedness for anticipated future shocks. But the sooner you can start to wrap your head around what this is going to look like, once the crisis is abated enough, how can you start to move your organization and your community either back to what it was before this, or ideally more informed and better and more resilient? The sooner you can start to wrap your head around that, the better off you're going to be and the more effective you're going to be at driving all of it. Want to just highlight what you can look for from Third Plateau as we keep moving all of this out. One, we're going to post this webinar. We'll share the slides. We'll put the recording of this up. and make sure that, that you have access to it. 2, developing a slate of free resources around each of these 4 stages, right? What are some frameworks or what are some worksheets for the response plan, for mitigation, for preparedness, and making sure you've got access to all of those. As I'm sure you can feel, like there's a lot more information on each of these 4 phases. We're putting together a pretty in-depth 4-part webinar series that goes really deep on each one of those stages: response, recovery, mitigation, and preparedness, and trying to make them more hands-on so that you can really start to dig in and figure these out for your organization. Finally, we're here. Like we're here, we're of service. We care so much about how all of this goes. Reach out if there's anything that we can be doing to help. Always happy to be a thought partner, happy to help facilitate through something, happy to figure out how to customize this for your specific organization and situation. Please do not be shy in reaching out. And we'll make sure that you've got our contact information for all of that as well. Marie, before we open up for a couple of questions, anything that you want to, anything else you want to highlight?
Nope, I think we can just move to questions.
Great. Carly, anything popping up on Q&A that you think makes most sense for us to start with?
Yeah, we had one question about the scale for estimating risk. Is it just 1, 2, 3, or anything that you two would add there?
Yeah,
I can. Oh, go ahead, Marie. Go ahead, Marie.
Yeah, so basically the point of estimating risk is to do it however it makes the most sense for you. It's not an exact science. It's a way of sort of factoring in the different variables that you need to think about a specific shock. I prefer to use 1, 2, and 3 because it's not an exact science. So putting it on a scale of low, moderate to high is pretty easy to do. Whereas if you're using a larger scale like 1 to 10, you're adding a lot of noise and something that can't actually be quantified, and it can distort how that comes out in terms of what your priorities are.
I just want to stress how critical that is for this exact moment too, right? Is that if our brains are not operating super strategically, a really nuanced rubric to figure out exactly how much risk is probably not designed all that well. Keep it scrappy, keep it quick. 1, 2, 3 for low, moderate, and high is good enough for now to keep you moving in the right direction.
All right, we just got another
Carly, any
question.
other questions on the Q&A that we should dive into?
Yeah, just got one more. Regarding estimating risk, can you guys explain again what vulnerability means?
Reed, you want to take that? You want me to take that?
Sure, I can start. Vulnerability is really just a matter of how exposed you are to that specific risk, as well as you can think about it in terms of your ability to mitigate that risk. So how vulnerable are you to that happening for yourself, for your organization, for the population you serve? How exposed are you to that potential event? And then how effective do you think you can mitigate that? So in the example that Jonathan gave of volunteers not showing up, you're highly exposed to that, but you can start thinking now and implementing actions in your mitigation strategy to make yourself less exposed.
Great, thanks, Marie. Not seeing any other, oh, we just got one more question. Someone would like to know, can you talk a little more about when to move to recovery?
Yeah, I mean, the short answer is as soon as possible, but just acknowledging, like, on the hierarchy of needs, that's significantly lower than dealing with people in a current, response need needs to take priority, and anticipating what might be coming. Again, if you think about each of these as independent disaster cycles, right? Each individual event's going to have its own disaster cycle tied to it. You're in a situation right now where you're getting one disaster cycle added on top of another, on top of another, on top of another. And that's the cascading effect of these. And so it's really hard for us to wrap our heads around what recovery looks like right now because there's still more disaster cycles getting added to us. But each one of those disaster cycles has a recovery period. So there might be instances where you can actually separate out a specific disaster, like a specific shock, and move to recovery on that one while you're also still responding to a different shock.
Yeah, You don't want to move into thinking about recovery from the major incident until those cascading effects have started to diminish, because you might be implementing a response that then is rendered totally ineffective by the next shock that comes along. A good analogy is that you don't want to start rebuilding your house while it's still on fire. So once once you're able to actually demolish and start to rebuild, you can think about recovery before then, but you probably shouldn't be implementing until the situation is relatively stabilized.
I will say there are times, just seeing who's on this call, I know a lot of your teams and your staff, like recovery can be a really valuable thing to also like get people to explore a little bit on just the mental health side of why they signed up for this work in the first place, and getting people to realize that what they're currently experiencing is really critical to pay attention to, but this is not their permanent reality. And so there are ways that you can get people starting to think about some of the recovery pieces to like remind them why they do this and that ultimate impact that they're pushing for. But otherwise, I think that the house on fire metaphor is pretty apt.
Right. Jonathan, Marie, do we have time for a couple more questions? I have seen a few more come in.
Go for it.
All right, so we've got a couple in here that are sort of related about who should be leading the team response. One person asking, they've got a management team that helps with, everything in terms of organizational leadership. Should that team be the disaster response team, or should they think about a new ad hoc team? And then relatedly, somebody asking, if you're not personally part of the response team, but you want to be, how can you advocate to help?
It's a good question. Go ahead, if you want to start, and then I can add some context for this as well.
Sure. Just on whether you should be using your regular management team or thinking about this differently, I would encourage people, it depends on what you're doing, but especially if you have a population that you serve, you definitely want people as a part of that response planning that are closest to the population being served, which usually is not necessarily who's the leadership at your organization. It's really important to have a pulse and have people who can talk to the people who are actually experiencing the crisis that you're trying to respond to or plan for. So thinking about who has a vantage point on the various pieces that are going to be really important to implementing an effective response, that should really guide whether you're using those existing structures or thinking about that a little bit differently.
I think the other nuance that I would add to this is that I think there's two really critical things to keep in mind. One of them is you want that whatever that team is that's navigating this, you want to make sure that it is full of diverse perspectives, right? Like if everybody's already thinking about it or has the same vantage point on it, it becomes really difficult to know if you're thinking about this as holistically as you need to. The second one is you need a team to be designed for speed, right? Like you want to be able to act quickly. This is not like the number of times I see things in organizations get sent off to committee where they go to die because it just sits there and spins around forever and ever and ever. You got to avoid that in this situation. So thinking through the individuals on your team that can represent or tap into other perspectives and that are already geared to operate quickly, I think is probably who you want to see running a lot of this. And so some power dynamics in your organization are going to matter because people with more authority in an organization are probably better equipped to move quickly. They need a lot less approval. So trying to figure out, like, somebody from management needs to be involved. I don't necessarily think it needs to be the entire management team. And if you're somebody on your team who wants to get involved is not, this is a situation that I'm seeing where if you've got ideas and you want to help and be of service, let it be known and be proactive. Share that with your supervisors or the leadership at your organization. More often than not, they will tap you and say, great, how can you help? Let's figure this out. So it's like an all hands on deck situation. Be proactive and figure out how you can help.
Great. Thanks, Jonathan and Marie. I know we are at the end of our time here. I'm seeing two last questions if you guys are able to go a minute over. We'll maybe start with one that may be more relevant for folks who have to jump off. When can we expect more information on that 4-part webinar series?
Very soon. We will we'll have a sign up for that probably going out the very, very beginning of next week, and hope to start that webinar series as soon as possible afterwards.
Great. And then last question that I'm seeing in our Q&A is with regard to fundraising communications, how can organizations balance the needs that they're having right now, especially with many of them or experiencing disruptions to their regular donors, and balancing that value that they're providing without looking like they're ambulance chasing? Yeah,
I cut out there for a second, Carly, but it sounds like the question is how how do I navigate fundraising in this climate without ambulance chasing?
Exactly.
Yeah, I appreciate the direct question on it. Look, I'm seeing organizations getting really creative about fundraising. Think about what you do. Think about why your donors are part of this and part of your organization in the first place, or why your prospective donors are, you consider them your prospective donors. Again, like this goes back to what we talked about early on in the response planning of keeping your North Star front and center. Why does your organization exist? What's the problem you are built to solve and the impact you're built to drive? And leading with that in your communications makes you not an ambulance chaser. It makes you an effective leader of your organization. The climate has changed. The context has changed dramatically. So your communication and your approach and your strategy on all of this needs to change dramatically. I think being really transparent about how things are changing and what decisions you're making, even with your funders, is a really powerful tool to get them on board as partners and not as just transactional donors for it.
Great, thanks, Jonathan. At this point, that is all of our questions and also all of our time. So if either of you want to offer any closing thoughts, I'll let you go ahead.
I just want to, on behalf of me and Marie and Carly and the rest of the Third Plateau team, like our hearts are with you guys right now. It's scary, it's unnerving, it's overwhelming. This is just none of us have gone through this exact situation before. And just know that we're here. We're always here to help out. Please don't hesitate to reach out. And we will keep pushing everything we can out there proactively that we think can help. But good luck with everything. Do something for yourselves to keep your own mental health strong. And really look forward to seeing what emerges out of this, because there's amazing opportunity to challenge some of our underlying assumptions and come through in stronger ways. All right. Thanks, everybody.
Bye, everyone, and thank you.